Please listen carefully.
Hello, universe. Welcome to the Optimist Daily Update. I'm Summers McKay.
And I'm Kristy Jansen, and we're part of the team behind the Optimist Daily, making solutions the news. We bring you reader-funded solutions news every day in order to change the tenor of news media, social media, and the direction of your day to help make it one focused on solutions.
7 days a week, we publish positive news stories written by our award-winning journalists and super cool people and deliver them online to your inbox and through our social channels. Except for TikTok. We don't deliver through TikTok. And also, we are sharing these solutions in a commute-worthy, walk-worthy, home office-worthy podcast. Today is Tuesday, the 27th of July, 2021.
Summers, there's at least three other social media platforms that we don't use either. So
that's true. Like we're not on Snapchat. We're not on
not on Discord or Twitch or some of the other newer ones too.
Is Parler even still around? I don't think it is.
I don't think so.
What's the other one? Discord. And then there's like the chat one where you go and just like, we should have one on there.
Oh, on Clubhouse. We should
Clubhouse, right? We should. Yeah. Somebody invited me to the Clubhouse, a person I really admire and like, and I just do not have the bandwidth to understand a new thing.
Summers, there's only so many hours in a day. And aren't we all trying to limit our screen exposure and our information overload that causes emotional turmoil?
Yes. And the emotional anxiety and turmoil.
Yeah.
But so. I mean, but that leads to kind of an interesting conversation, though, because as Kristy and I were talking, we used to live in the same area, and now we do not live in the same area. And we used to have similar news, and now we do not get similar news. And I had no idea that there were massive fires on part of the United States, because that just was not part of the information that I am getting fed into my news media. So, Kristy, what's going on for those who are like me and aren't aware exactly of the fires that are happening?
One of the worst fire seasons ever, as every year seems to be. There's more than 80 fires raging across the western United States and western North America. I'm not being impacted by it right now in the Southern California, but Northern California, I think there's several different fires that have now joined, that have merged. Oregon has been burning. British Columbia has been burning. Our producer, Amelia, who's in Montana, is experiencing poor air quality. So it's really present. And I'm even hearing people in New York City who are being impacted by bad air quality because it's going all the way across the middle northern part of the country and getting into the air in New York.
So part of the reason this came up, Kristy, is because one of our headlines is how to protect and soothe skin from smoke exposure. And it's a great solution today, but I had no idea. And I think that's what happens for a lot of us, is that we get very directed, very specific media when we go online, when we look at our Google feeds. And if you're not turning on the nightly news, or if you're not looking at national news, you're not going to get all of the information, the stories that you need. So when I logged on to optimistdaily.com this morning and I was looking at our headlines, I thought that was just really insightful, because we work really hard to make sure we're delivering all of the positive solution-based stories. But sometimes even somebody who works at the Optimist Daily can get in her own news funnel.
Well, I think all of us will. And I mean, in some ways, you don't really need to know about it because you're where you are in Central Texas, and maybe you need to be more aware of hurricane warnings or something else coming down the pipe, thunderstorms that's going to impact you more directly. I mean, this is just a comment on the 24-hour global news media and the cycles there. Like, part of the inflammation that happens on an emotional level is that we're seeing disasters that are happening all the time everywhere in the world. And yes, it's good to be informed, but it's also good to take a step back and look at what's happening in your community.
And like figuring out what you can do in community. What are the solution-oriented focus things? Yeah.
Right. And so that is kind of a little lead into my headline that I wanted to focus on today. which reads, White Mountain Apache Nation shows efficacy of community-oriented public health. And the other headlines that we're all seeing right now are in relation to COVID-19 and vaccination rates and how unvaccinated people are more risk of having severe disease. We're getting breakthrough infections in people who are vaccinated. And it just seems like that's in the headlines again, which is part of why, Summers, you're not seeing anything about the wildfires that are raging across the Western United States because COVID.
COVID is a more salient sort of national news story. Yeah.
And it's impacting people in different communities all over the country and in fact all over the world. So that's what we're seeing and reading on the national news. But anyway, this article is looking at how Native American nations have been improving vaccination rates in the different states that they are located in. We wrote about this in March in relation to Oklahoma and the high levels of vaccination in Native American nations in Oklahoma were raising the overall state vaccination rates. In Arizona, a similar thing is happening. The White Mountain Apache Tribe has proven to be a model for managing the pandemic after they were hit hard by cases early on. But by September of 2020, the tribe had recorded 2,400 cases and had lost 39 people. And that's a significant impact.
Definite impact.
You know?
Yeah. How devastating.
So in response, they got together and they created a response team made up of medical professionals and community leaders. And they met every morning and they actually took a door-to-door approach, evaluating case numbers and tracking down anybody who had potential exposure. And once they identified that potential exposure, then they used thermometers, pulse oximeters, and they helped to stop outbreaks before they went anywhere. And so this community response and the community approach is a great example of how having that connectedness and that feeling of we're all in this together and actually going, building relationships at a community level, how important that can be. Based on that response, then that was a good foundation for vaccine outreach once they became available. And so those same people who had already been involved with managing spread and outbreaks were then able to go in and say, hey, let me explain how these vaccines work. Let's get you vaccinated without raising fears and misinformation. And so then that has become a strategy that can be potentially applied to other vaccine hesitant regions if we just invest the time and resources in that kind of approach.
And get really personal. I think we wrote a story. Right. I'm not sure if it was Virginia or West. I think it was West Virginia, having like a super high penetration of vaccinations because they were using local from the very beginning, right? And I don't know how that has panned out, but they were using local pharmacists and local relationships that existed to communicate any.
And part of that in both cases, it's because of the lack of more mainstream, like in West Virginia, they don't have a lot of like CVS or Walgreens, these sort of national chains. It's more locally owned pharmacists because it just hasn't been as financially rewarding for big companies to get in there. But that actually ended up being a benefit for the communities.
Yeah. Well, and the conversation about vaccines has, continues to be really divisive in some communities and in some families. And I know even in my own family, there is division. We have expectant mothers. We have people who have not had good experiences with vaccines. And then I, on the other hand, am, hook, line, and sinker, give me the shots, And so it's a conversation that misinformation can really propel extremist opinions. Whereas if you have relationships and you have physicians and you have medical practitioners who are talking within communities and they have trusted experiences, everyone can get closer to a similar page, recognizing that we're not all ever going to be on the same page, but people can get closer to having the same valuable, accurate information. So I love this story. And I love that reminder that we can impact our communities with relationships and small actions. And sometimes, though, we need bigger strokes with bigger brushes to make bigger change, huh?
Absolutely. So what are you going to talk about today, Summer?
All right. Well, as many of you guys are well aware, I struggle with plastic in our lives. And as a parent and a very busy person, eliminating plastic from my experience seems legitimately impossible. Even down to discussion with the team this morning, we were talking about how, the producing team and Kristy have all stopped buying small bags of veggies and instead buying, the large ones that you bag yourselves at the grocery store. And I was like, but then how do you quickly make baby carrots for your daughter who suddenly needs to eat immediately? And I struggle with resources and availability and efficiency in reducing my use of plastic in this world. Well, there is a campaign that wants to remove single-use plastics from the big screen. Now, this has happened before. Basically, the premise is currently characters in favorite movies and TV shows tend to use a lot of single-use plastics. It's the busy professional grabbing a cup of joe on the way, or an athlete drinking out of a plastic water bottle. Media definitely normalizes the use of plastics, and producers who are producing and, film directors who are directing aren't prioritizing the use of demonstrating a reduction in the use of plastic. Now, Habits of Waste is trying to end the presence of single-use plastics in TV and movies. Their program, which is called Lights, Camera, Plastic, Habits of Waste is encouraging producers and directors to advocate for highlighting reusable options on the screen. They have a list of downloadable resources for productions aiming to go waste-free, and shared resources for all the folks involved, including set designers, news correspondents, and other industry members to share the idea on plastic-free filming.
And I think this is a cool idea. And if you think about it, like television placement can really normalize behavior. If you think about smoking in the 1940s, having all the female actresses smoke made it seem more normal for women to smoke, even though they weren't smoking up until that point. And then banning smoking on TV,
broadcast,
or making it like, hey, that's kind of, let's not normalize this anymore.
But speaking of smoking on TV, I think the advent of streaming, and this is my hypothesis, definitely something we should go research with our editorial team, but I believe that some of the streaming channels allow for, I know, right, that some of the streaming channels and non-broadcast channels allow for more use of tobacco products because I'm starting to see it again in ways that I hadn't. And
also alcohol use.
Yeah, well, exactly. The alcohol use, right? And like you could have a glass of wine, but you were talking about something that when you were earlier in your TV watching days, families used to, like sitcoms, families used to never sit around and watch TV.
Right. Which is sort of weird when all of us, what we were doing was sitting there watching TV, if you think about it. And even when they do show people watching TV, it's much less a part of their lives than all of us.
Well, exactly. They don't show the ER doc sitting in her bed, watching her 6th episode of Modern Family over the weekend.
Binging an entire series over the weekend and not leaving your house.
Right. No TV series is showing us doing that. But TV does, and mass media and broadcast media does have an incredibly powerful access to showing solutions, to showing better choices. If you imagine that, every time you're watching people showing up at a coffee shop and characters that you love and admire are going to the coffee shop to grab a cup of coffee, and they are bringing their own reusable cup to get refilled with their coffee for their morning fix on their way to the ER or to solve that crime case or to slay that vampire. That normalization of the behavior of using not single use, but reusable plastics or your glass jars at the supermarket.
Everybody had their Hydro Flask with them all the time and just like hanging off their belt.
The way that you said that, it now sounds like this campaign brought to you by Hydro Flask, a better way to water.
Hey, well, it could.
It's true. But I love this idea. I love the idea of, maybe if you look at all gym ads, right? If all the fitness and gym ads always were showing, even our gym here in Texas, every single day I go in and I bring my water bottle and I'm like, do you have a water bottle refilling station yet? Because they have these awkward drinking fountains because they are trying to incentivize people to buy the drink products in the refrigerators, right? That's an upsell area for a gym. And so they don't want to have reusable water, they don't want to have a water bottle filling station. But if every time the Kardashians, went to the gym, they used refillable hydro flasks, maybe Gold's Gym would come along board.
One thing I will say about traveling recently is that all the airports now have water bottle filling stations. And that's relatively new. And I appreciate that.
Well, I do too. And I look forward to someday traveling again.
Not to rub it in, Summers. What else are our headlines? We got to wrap this up, but I want to read the headlines.
Okay. All right. So other headlines, we have an endangered baby tapir that is on an important conservation mission. France will ban the culling of unwanted male chicks by 2022. Snakes, good old snakes again, assist scientists in studying areas affected by nuclear disasters. Zelp makes methane-reducing masks for cows. What else, Kristy?
Which I think is a little controversial, but we won't get into that. And I think one of our new writers must really love snakes because it seems like every day we have an article about snakes. So I find that very amusing. Other headlines to think about. The one we talked about from the beginning of today's show about how to protect and soothe skin from smoke exposure. There's a new IBM tool which quantifies the amount of carbon in individual trees that they're sequestering. How working dads can stay involved at home once offices reopen. Keep that balance of home work life. That's important for all of us. And study is confirming that COVID vaccines provide protection against severe illness. Just to reiterate, get vaccines. We're fans of vaccines.
Yep. We are.
And so that's it today for the Optimist Daily. Thank you so much for listening to the Optimist Daily Update. We promise to continue to share positive solution-based stories with ideas on how you can get active and participate in changing the world in a good way. And we promise to keep covering current events with accuracy, legitimate sources, and offering you information that is crucial for all of us to help chart new paths. Summers, you want to take us out?
I'd be happy to. Hey guys, it is the end of the month. As always, you guys know I have a number we've got to meet for our investors. We want to keep the Optimist Daily free for all who need it, supported by those who can. You can become an annual member on the Optimist Daily at optimistdaily.com today. And for just $5 a month or $60 a year, if that's easier for you, support reader-funded independent journalism. Be part of the solution-changing consciousness in addressing our world's biggest challenges with a problem-solving mindset. Thanks, everybody, for listening. Love you guys. We'll see you tomorrow on Hump Day. Bye.